when Joslin published an article about his clinical experience with diabetes for the Journal of the American Medical Association, his opinion had changed considerably. He was no longer talking about the wholesome tendencies of diabetics to seek medical help, but was using the word epidemic to describe what he was witnessing. On the broad street of a certain peaceful New England village, there once stood 3 houses side by side, he wrote, apparently talking about his hometown of Oxford, Massachusetts. Into these 3 houses moved in succession 4 women and 3 men, heads of families, and of this number, all but 1 subsequently succumbed to diabetes. Joslin suggested that had these deaths been caused by an infectious disease, scarlet fever, perhaps, or typhoid, or tuberculosis, the local and state health departments would have mobilized investigative teams to establish the vectors of the disease and prevent further spread. Consider the measures, he wrote, that would have been adopted to discover the source of the outbreak and to prevent a recurrence. Because diabetes was a chronic disease, not an infectious one, and because the deaths occurred over years and not in the span of a few weeks or months, they passed unnoticed. Even the insurance companies, Joslin wrote, failed to grasp their significance. We've grown accustomed, if not inured, to reading about the ongoing epidemic of obesity. 50 years ago, 1 in 8 American adults was obese. Today, the number is greater than 1 in 3. The World Health Organization reports that obesity rates have doubled worldwide since 1980. In 2014, more than 500 million adults on the planet were obese, and more than 40 million children under the age of 5 were overweight or obese. Without doubt, we've been getting fatter, a trend that can be traced back in the United States to the 19th century. But the epidemic of diabetes is a more intriguing, more telling phenomenon. Diabetes was not a new diagnosis at the tail end of the 19th century when Joslin did his first accounting, rare as the disease might have been then. As far back as the 6th century BC, Sushruta, a Hindu physician, had described the characteristic sweet urine of diabetes mellitus, and noted that it was most common in the overweight and the gluttonous. By the 1st century AD, the disease may have already been known as diabetes, a Greek term meaning siphon or flowing through, when Aretaeus of Cappadocia described its ultimate course if allowed to proceed untreated. The patient does not survive long when it is completely established, for the marasmus, emaciation produced, is rapid, and death speedy. Life, too, is odious and painful, the thirst is ungovernable, and the copious potations are more than equaled by the profuse urinary discharge. If he stop for a very brief period and leave off drinking, the mouth becomes parched, the body dry. The bowels seem on fire. He is wretched and uneasy, and soon dies, tormented with burning thirst. Through the mid-19th century, diabetes remained a rare affliction, to be discussed in medical texts and journal articles, but rarely seen by physicians in their practices. As late as 1797, the British Army surgeon John Rollo could publish an account of 2 cases of the diabetes mellitus, a seminal paper in the history of the disease, and report that he had seen these cases 19 years apart, despite, as Rollo wrote, spending the intervening years observing an extensive range of disease in America, the West Indies, and in England. If the mortality records from Philadelphia in the early 19th century are any indication, the city's residents were as likely to die from diabetes, or at least to have diabetes attributed as the cause of their death, as they were to be murdered or to die from anthrax, hysteria, starvation, or lethargy. At Massachusetts General Hospital, the very same handwritten medical records that Joslin would later analyze reveal that for 20 of the 45 years between 1824 and 1869, there was not a single case of diabetes. In none of these years were there more than 3 cases.